Hi friend, I am Sudeep. Welcome to my YouTube channel Pharmacy MCQ Guide. Okay, this video is beneficial for railway exam, ESI central exam and AIIMS hospital exam and other state government exam. It is only for nursing student, pharmacist and other medical professional. Okay, so today we discuss about the topic human anatomy and physiology, blood part 1. At first, we know that what is the definition of blood. Normal basic definitions. Blood is the liquid connective tissue. Okay, the pH of the blood is 7.4. So, generally, the first question is the amounts of the RBC present in the blood called which terms? The amounts of the RBC present in the blood called which term? Option number A, hemoglobin. Option number B, haemopoiesis. Option number C, hematocrit. Option number D, myoglobins. Okay. So, now option number A, hemoglobin is one type of iron containing metalloprotein. Okay. That is present in RBC, which is transported through the blood. Generally, hemoglobin contains the 4 chains, alpha 1, alpha 2, beta 1, beta 2. Okay, so hemoglobin is not the right answer. Option number B, haemopoiesis. What do you mean by the haemopoiesis? Haemopoiesis means the procedures of the formations of blood cells in our body. Actually, the abnormal precursor cells converted to the mature blood cells in our body, that is called haemopoiesis. So option number B is not the right answers. Option number C, hematocrit. Hematocrit means it is a process in which the amounts of the RBC in the blood is also detected. As for example, hematocrit level 40 means the blood volume 40% occupied by RBC. Okay. Option number D, myoglobin. Myoglobin is one type of iron and oxygen binding proteins present in our body. So that is generally specially present in skeletal muscles. So the right answer is option number C. Hematocrit is the process in which the amounts of the RBC present in the blood. Question number 2. What is the site of haemopoiesis in an embryo? Option number A, yellow sac. Option number B, liver. Option number C, thymus. Option number D, spleen. Now, at first we know that in the first stage of the haemopoiesis generally present or generally occurs in yellow sacs of the embryo, and then in next steps also occurs in liver, thymus, spleen, etc. So the right answer is option number A, yellow sac. Yellow sac is the first site of the haemopoiesis in an embryo. Question number 3. Which term indicate the low count of the platelets? Option number A, leucopenia. What do you mean by leukopenia? The abnormal decrease in the WBC count in our body, that is called leukopenia. Option number B, leukemia. Abnormal increase of the WBC count in our body, that is called as leukemia or blood cancers. Option number C, thrombocytopenia. What do you mean by thrombocytopenia? Now, abnormal decrease in the platelet count in our body, that is called as thrombocytopenia or part-1. Option number D, anemia. Anemia means decrease in the RBC in our body, that is called as the anemia. So the right answer is option number C, thrombocytopenia. In which condition? Abnormal decrease in the platelet count in our body. Question number 4. In which conditions bone marrow does not produce the RBC in the body? Option number A, hemolytic anemia. Actually, what do you mean by hemolytic anemia? Hemolytic anemia is one type of the anemia in which case abnormal destructions of the RBC in our body, abnormal destruction of RBC. Okay. Option number B, aplastic anemia. In these types of anemia, suppressions of the bone marrow in our body by any chemicals or toxic materials. So as a result, the bone marrow does not produce any types of the blood cells in our body. Option number C, iron deficiency anemia. In these types of the anemia, generally normally iron deficiency occurs in our body, or iron levels low in our body, so that is called as the iron deficiency anemia. Option number D, thalassemia. What do you mean by the thalassemia? Actually, thalassemia is a genetically disorder in which conditions the 4 chains of hemoglobin such as alpha 1, alpha 2, beta 1, beta 2 are not properly formed or abnormally formed. Actually, when alpha 1 or alpha 2 chains generally not formed, that is called as alpha thalassemia, and when beta chains are generally not formed, that is called as beta thalassemia. So the right answer is option number B, aplastic anemia is the right answer, in which conditions bone marrow does not produce the RBC in our body. Question number 5, which types of the anemia is responsible for the thalassemia? Which types anemia is responsible for the thalassemia? Option number A, aplastic anemia. Option number B, hemolytic anemia. Option number C, iron deficiency anemia. Option number D, none of this above. So the right answer is option number B, hemolytic anemia. Hemolytic anemia is one type of anemia which is responsible for the thalassemia. Question number 6, which of the following not a plasma proteins? Which of the following is not a plasma protein? Option number A, albumin. Option number B, globulin. Option number C, fibrinogens. Option number D, fibronectin. Actually, option number A, B, C, albumin, globulin and fibrinogen is one type of the plasma protein in our body, but option number D, fibronectin, is not a plasma protein. So what do you mean by fibronectin? Actually, fibronectin is one type of extracellular matrix proteins. Extracellular, it is not the plasma proteins. It also bind generally collagen with fibrin. It also bind collagen with fibrin. So it is one type of extracellular protein, not the plasma protein. So the right answer is option number D. Question number 7, which leucocytes release the heparin? Leukocyte is the another name of white blood cell, means WBC. So option number A, neutrophil. Option number B, basophil. Option number C, eosinophil. Option number D, monocyte. Actually, these 4 options includes the types of WBC or white blood cells, but in these options or types, the right answer is option number B, basophil. These basophils is one type of the leukocytes or white blood cells which contain the heparins. What is heparins? Now, heparin is naturally occurring anticoagulant. What do you mean by the anticoagulant? Anticoagulant means it is a substance or drug which prevent the clotting in our body, which prevent the blood clotting in our body. So right answer is option number B. Question number 8, red cell count is carried out by option number A, electrogram. Option number B, sphygmomanometer. Option number C, hemoglobinometer. Option number D, hemocytometer. Actually, option number A, electrogram, is generally used in case of the heart. Okay, so it is not the right answer. Option number B, sphygmomanometer. Sphygmomanometer is the procedure or measurements of the blood pressure, so it is not the right answer. Option number C, hemoglobinometer. It is the measurements or count of the hemoglobin level, so it is not the right answer. Option number D, hemocytometer, is the process in which condition red cell count is carried out. So option number D is the right answer. Question number 9. Absence of which clotting factor leads the haemophilia-a? absence of which clotting factor? Generally total 14 clotting factors are generally total 12 clotting factors are generally present in our body. So which absence of which clotting factor leads to the haemophilia-a? Option number A, factor 7. Option number B, factor 8. Option number C, factor 9. Option number D, factor 10. So option number A, factor 7. What is the name of factor 7? What is the name of factor 7? Proconvertins. Proconvertin is the name of factor 7. Option number B, factor 8. It is called as the anti-hemophilic factor A. Option number C, factor 9. Factor 9, what is the name of factor 9? Now factor 9 means Christmas factors. Christmas factors is the name of factor 9. Option number D, factor 10, Stuart factor. Stuart factor is the name of factor 10. So the right answer is option number B, anti-hemophilic factor A. So what do you mean by the hemophilia? The hemophilia is the genetic disorder in which conditions excessive bleeding occurs in our body. So bleeding is not prevented. Irregular bleeding is occurs from your body or from any sides of the body. So option number B, factor 8 is the right answer. Question number 10, which blood cells secretes the antibody, or which blood cells related to the antibody? Antibody is one type of the substance which protect in our body, which also protect in our body. So option number A, eosinophils. Option number B, monocytes. Option number C, lymphocytes. And option number D, neutrophil. These four options includes the types of the WBC or white blood cells. So option number C is the right answer, lymphocyte. Lymphocyte is one type of the white blood cells which also related to the antibody, because lymphocyte is one type of the antibody. Okay, generally lymphocytes two types of T lymphocytes or B lymphocytes. It is the part of antibody which also helps to the protections in our body, produce the protection in our body. Okay, so please like, share and subscribe my video for next update. Thank you.